Good morning. I'm Christopher LaPrade, and welcome to this news briefing from the 254th National Meeting and Exposition of the American Chemical Society in Washington, D.C. We're joined today by Dr. Kim Janda from the Scripps Research Institute. He's been developing a vaccine to prevent the effects of both fentanyl and heroin. Dr. Janda?
Thank you. So I think we all realized with most recent events, the opioid epidemic has really grabbed our nation. It's really cut at the fabric of society these days, and people are trying to find ways to cope with it. So over the last 8 to 10 years, I've been developing a heroin vaccine specifically to try to counteract the effects of the drug. The vaccine would be used for people who are undergoing substance use disorders, so who are addicts. The vaccine, we've shown value. It also can have an effect on lethality doses, so possible overdose it could protect against. A couple years ago, because I saw an increase with synthetic opioids, we decided to also try to develop vaccines against these synthetic opioids like fentanyl, which are much more powerful than heroin, some 50 to 500 times. More recently in the news today, we've seen carfentanil is a major problem, which is almost 1,000 times more potent than morphine. So we've also decided to work on that, a combination of these. The vaccine against fentanyl is more broadly based versus the heroin one, in that we see a number of designer fentanyl analogs which are creeping in that are made in clandestine labs, such things as China white. And so that vaccine can cover a number of different derivatives, where the heroin vaccine is quite specific. The other value of the vaccine is that it can be used in conjunction with therapies like methadone treatment or even buprenorphine. It won't have any off effects. So in a nutshell, I think the vaccine has some potential of moving forward, used both on its own and in conjunction with other therapies. So some of the slides that we have, the first one basically shows some of the work that we've done more recently with non-human primates, and so trying to validate its value in moving forward into clinical trials. The next slide shows the vaccine with two different doses. One is a very low dose. You can see the one mouse in the corner at a 2 mg per kg is basically almost sleeping. The other mouse, we gave a huge dose of 18 mg per kg, which, in the lethality range, and basically happy as a little clam running around. So the vaccine can take large doses, and so we think that that'll be of value in the future. And then the final slide just shows basically how the vaccine works. We create a specific immune response. We train the immune system to recognize heroin as being foreign, or the synthetic analogs like fentanyl as being foreign. The antibodies are alerted to that, and so when the user takes the drug, the antibodies basically block the drug from reaching the pleasure centers in the brain. And so if that doesn't happen, the basically overall psychoactive effects of the drugs are counteracted. So that's pretty much in a nutshell how the vaccines work. And I guess any questions? We can take some questions if they're needed.
So it's Kath O'Driscoll, and he's from Chemistry and Industry magazine. I was interested, you mentioned about it reducing the lethality, the possibility of overdose. How exactly, what's the mechanism? How can it do that, and by how much could it reduce the sort of dose?
Yeah, so these vaccines were never intended for lethality or overdose, but it became clear a number of years ago that what happens with people who are substance use disorders, specifically with opioids, when they stop taking them and then they go back and maybe sample the drug again, they're much more sensitized to overdose. And so what we believe the vaccine can do, and we've shown this in at least rodent studies, that larger doses can be counteracted, and so blocking the so-called effects. But that's not the intent, but I do think that in going forward, it can have some overall protection for people, specifically who are undergoing cessation therapy, where they may be more susceptible to overdose if they do have a weak moment and go back and take the drug. And as we know, substance use disorders is a lifelong problem, and people have urges and tendencies to want to have just what's called a little taste of the drug, and what happens is they spiral out of control and to basically bottom out. And so we think the vaccines will have the greatest impact where people who are trying to stop taking the drug, undergoing therapy, and basically it should block its effects so they can continue on with the therapy. And like I said, may also have some potential in blocking overdose.
How exactly would people take the vaccine as well? Would it be a one-off vaccine, or would it be something that they would need to take?
No, the vaccine would be administered like day 0, and then a month later you get a boost, and then maybe another month later another boost. And the vaccine we've seen in non-human primates will last for several months, and then one would just need another boost and it will come back up again for several months. So it'd be a series of injections.
And how in terms of its efficiency, how does it compare with something like methadone?
Well, methadone is an agonist, so it's similar in a number of senses to heroin. It's just not as strong or in terms of the long-lasting effects, but people can become addicted to methadone, and you can have overdose cases with that. So it's very different, but like I said, it could be used in conjunction with methadone treatments. The vaccine I made is very specific for just heroin, and it's so-called metabolites that have psychoactive effects. So it could be used with methadone. It could be used with another thing these called partial agonists, buprenorphine also.
And I know you've already done the studies in monkeys, so the next stage, I guess, would be to try it out in people. Have you any plans? Is there any?
So the next step would be to try to go forward and manufacture the vaccine. I should also say that we had some other things we haven't reported on that I'm speaking about today was the overdose, that we show some value there. And the other piece is we've been able to overcome the cold chain. So typically vaccines have to be maintained at 4 degrees C. And so I also envision these vaccines to be used in third world countries where there's an issue with a spike in HIV with injectable drug users. So places like in Africa, Russia and China. So they wouldn't have to be kept cold. We've been able to overcome that problem. And the other reasons why we're using vaccines, which most people don't know, is vaccines have saved more lives in the last 50 years than any drug or therapeutic. And they're very inexpensive to manufacture and make. So we think that's also added value with, we see the steep curve with the number of drugs and their costs. This should be inexpensive.
Thank you.
Bela Buslik, ACS Communication. We think of vaccines as preventive. Do you see a situation where you would try to administer these vaccines for an anticipated location where they might have people accidentally getting, or maybe semi-accidentally getting exposed to these opiates, or do you just see it to try to prevent the people that are already users from?
Yeah, I don't. So that's true. A lot of vaccines are considered preventative, like people think of like measles vaccines or mumps or polio. However, vaccines today are now also being developed for diseases where people have diseases, for HIV, bacterial pathogens. So we envision the vaccine not to be used as a prophylactic. We envision it to be used with people who are abusers. The point being taken for lethality, and so these new synthetic opioids that are creeping in, so the fentanyl derivatives, specific carfentanil, which is extremely toxic. This might be, long-term thinking. I could envision maybe prophylactically vaccinating people in law enforcement who may go in the field, even dogs which are involved in, seeking out the drugs could be vaccinated. That wouldn't be a problem. And then the other thing we're looking at is possibly developing monoclonal antibodies that could be used in conjunction with such things as Narcan, so naloxone for overdose. And so what we've seen is with these extremely potent synthetic opioids like carfentanil, Narcan doesn't work very well. And so we need to get some other adjuvants that could be used in conjunction with that. And so we see that there could be a value in the antibodies for that.
Thank you.
Great.
Katie Cottingham, American Chemical Society. So when do you think this could be available to the public? How many years down the road is this?
Yeah, we're trying to negotiate right now in terms of how we would manufacture it and move it forward, and if we can get that worked out. So we've been talking to several different companies, and if we can get that worked out, I would envision that we could get this into clinical trials within 18 to 24 months. So the heroin vaccine has been what we consider optimized. What we're going to do in moving forward is we're going to try to develop a heroin fentanyl vaccine, so a dual vaccine, because what we also see is heroin being cut up with these synthetic opioids, if that answers the question. So in that, people ask, why is that happening? And that's based on economics. So when the cost of heroin goes up or the purity of heroin goes down, synthetic opioids come into play. It takes a couple months to grow a poppy. It takes a couple days to make a synthetic opioid. So yeah, that's our plan.
And can you describe some of the other vaccines that you're working on very briefly?
Well, I've worked on over the years methamphetamine type vaccines. More recently, we had a paper come out in Nature which describes a method and also a vaccine against a drug known as Captagon. It's been linked with a number of terrorist groups. Specifically, it's hugely abused in the Middle East and sold illegally there, both for obtaining funds for these terrorist groups, and also it's been linked with their use in terms of in the field fighting. Amphetamine-like drugs have been used since World War II and Vietnam. So this is a little bit different type drug, and so what we've been able to show is that, which never made sense, this drug Captagon is a mixture of amphetamine and theophylline, and it didn't ever make sense to me why they're not just taking amphetamine. And so what we showed in this recent paper in Nature is that the combination of amphetamine and theophylline makes this a super potent amphetamine, and so that's why we feel it's much more addictive and it's being used out there. And so in this work, we also developed a vaccine against this combination.
Hi. I was at a meeting earlier in the year, and they were talking about the US Surgeon General had just reclassified addiction as a disease, and they were showing some brain scans showing this effect of opioids on the frontal cortex. And I just wondered, have you done any studies looking at this brain region? Apparently it's involved in self-control, and they had some interesting results there. I just wondered if any of your vaccines have been tested.
Yeah, we haven't specifically looked at that, but there's been a number of researchers, specifically head of Knight and Nora Volkos, looked at this extensively in imaging the brain and how the brain is altered taking drugs, specifically the changes. I think one point that needs to be brought up in why people are so been against in the past of trying to put money into treating addiction is that most people feel the addiction is a moral failure on the part of the individual versus a brain disease, so a willful act. And so I think it's been shown quite clearly that changes in the brain are not due to this moral willful act. It's basically should be considered a disease.
Great. Any additional questions? Great. Thank you very much. We appreciate it.
Okay.
The archive version of this session will be posted at bit.ly/ACSlive_DC. Please join us for our next press conference at 1 p.m. today on clay-based packaging that could keep food fresh longer. Thank you very much.